Hi, Camille Roby here again, reporting to you from Adult Health 1 with Professor Lukowski's class, coming to you from Section 1, Term 2. So initially, in my primary IV medication administration video via the mini bag, before now, I would have, in introducing a brand new medication to my patient, Mr. Jones, which is vancomycin. This drug here is new to him, so not only would I have told him the actual dose amount that he would be receiving, but I would also give him a little background information in regards to what to expect as far as side effects and even possible adverse effects. So in the case of vancomycin, I would have prepared it with normal saline running over a primary. And so this particular drug type is an anti-infective, and it's used for the treatment of potentially fatal infections. It has a bactericidal action to it, so it's going to act as to kill this particular microbe or bacteria that may be causing the infection. The contraindication, one of the main contraindications is a hypersensitivity to this drug, and then side effects, ototoxicity, which deals with the hearing. So I would have informed my patient, Mr. Jones, that we would need to keep a constant watch on his hearing, both before and after, to test cranial nerve number 8, which is for hearing. Also for nephrotoxicity, we would have been, I would have let him know that we would be checking his labs as far as his bun and creatinine levels. And then also checking his white blood counts level as well. And then telling him that possible nausea and vomiting could occur, hypotension, and a specific type of rash, especially if the flow rate is rushed or going too fast. A rash by the name of redneck syndrome or redman syndrome could develop. And then I would also assess this patient for anaphylaxis. Both in the past, I would do a baseline and then to check again after the fact of administering this medication. A culture and sensitivity would have been done before actually even administering this drug, just to make sure that this would be the proper antibiotic to use. And then I will watch for any super infections, and as I said, if I need to, I can slow down the rate or I can dilute it. Now, in regards to my Piggyback drug, which is Zocin, as I mentioned in my video, this drug type is also an anti-infective. And just to take a look at that, it's a drug type. And so this particular action is also bactericidal, which means it's going to kill the bacteria. And it does so by binding to the cell wall or cell membrane and causing the cell death. Contraindications would be a hypersensitivity as well to any type of penicillin, cephalosporin, beta-lactams, or tazobactam, which that particular one could cause a cross-sensitivity to happen. Side effects would include anaphylaxis, seizures, possible superinfections, headaches, especially with the seizures, it could occur at a higher dose. Insomnia, diarrhea could occur, vomiting, and a more adverse effect, which is Stevens-Johnson syndrome. This could also happen to this patient, and even phlebitis at the site. So I would assess the skin constantly to make sure that does not occur or happen. And as I said earlier, I would have confirmed the dose with the patient to let them know what exactly the rate is, which was 14 drops per minute. All right, so this is what I would have done initially before actually going ahead and administering. All right, thank you.